food pantries, to keep them going, and then just keep building from there. My order to Commissioner Garcia is whatever it takes to feed New Yorkers, whatever the expense, whatever the effort, no matter how many city workers it takes, no matter how many volunteers it takes, we're going to do it.
Julia from the New York Post is up next. Julia?
Julia?
Julia, can you hear us?
Hi, Mr. Mayor. How are you?
Good. How you doing? Julia?
Julia, we can't hear you.
You're going to come back?
Yeah, we'll come back to
Okay.
her. Yoav from the city is up next. Yoav?
Hi, Mr. Mayor. I wanted to ask, you've made it clear beforehand when we've asked about the racial and ethnic data that providing the data was a secondary concern to saving lives. But here, in response to producing the data, it's clear that the city is taking steps that are intended to save lives. So why weren't you able to do that beforehand? Because clearly the data is important in determining how the city responds. So why was it secondary? Why was it secondary in nature? You've always said you can walk and chew gum at the same time. Why wasn't that possible here?
Because we're all walking and chewing gum on many, many levels. This is nonstop crisis, and everyone on the phone with me here and all my colleagues are working nonstop. The concern, and Dr. Barbeau can speak to it, is the health department was very concerned that there be something verifiable, that you have to make sure there was enough evidence, that it was confirmed, that we not put out something that was unclear or not based on enough data. So that is absolutely crucial. If we're going to tell people something, we better damn well be right about it. Also, as I said, what's happened out there is more data we'd like to be able to provide, and some of it is been hard to get as clear as we'd like, because in a crisis atmosphere, I assure you that folks at the front line are not focusing on, recording data when they're trying to save lives. So there's been real crisis dynamics that have mitigated against getting the kind of data we would in peacetime. And then there's been real concern to make sure that what we had was accurate and consistent and enough evidence over what's really been just weeks. Now that we believe it, that we really have something hard and fast, it's telling us what we got to do. But as I said in the beginning, the one thing that was unquestionably job one and remains job one for folks experiencing the disparity and everyone is to protect the hospital system. That's where the overwhelming majority of our efforts were going, to protect and build up our hospital system. And that was more important than anything, because that's what every New Yorker needs. Dr. Barbeau?
So to build on what the mayor laid out, I think, we've been focused on having complete data. And I've spoken before about the fact that our reporting is only as good as the quality of the data that we get in. And it's been a challenge to work with hospitals who are overwhelmed with patients in the intensive care unit, on the floors, in the emergency department, to focus on the more granular importance of data. And as I've said in the past as well, we've then resorted to alternative data sets in order to augment the data that we